Again, everyone. For those who've just joined, we just said that we'll give a couple more minutes just for one or two more people to join, and then we'll get started. But please feel free to introduce yourselves in the chat. Thank you. Okay, I think we can get started and people they can follow on as we go. So hello everyone and welcome to the launch of the South African Positive Mental Health Photo Library. My name is Michelet Donnelly and I'm the Communications and Awareness Lead at the SA Federation for Mental Health. Myself, as well as my colleague Jennifer Charlton, we're just really grateful to everyone for taking the time to join us as we launch this really necessary and important project. We're also looking forward to hearing more from Alexa from Mental Health Foundation UK, as well as Sue Baker this morning. Just a little bit about the South African Federation for Mental Health. We are a national human rights-based NGO, and we focus on advocating for the human rights of mental health care users in the country. We do a lot of public awareness information and education, really focused on raising awareness as well as ending stigma. We also work at a national level strategically with government to ensure, wherever policy is being made, that mental health is included. And we also work with 17 community-based mental health organizations. They are found across the country, and they are the ones who provide day-to-day essential services in communities that are quite often under-resourced as well as vulnerable. So thank you for joining us. Ooh. Before I hand over to Jennifer, I just wanted to give some house rules. Please, can I ask that everyone keeps their mics muted? This would be really helpful for us. Also, if there are any burning questions, do pop them into the chat, but we are going to have a Q&A session at the end. But yeah, any burning questions, pop it into the chat. And also just a note to say that we are recording the session. Thank you again, everyone, for joining. And I'm going to hand it over to Jennifer now to introduce herself, but also share a bit more about the inspiration and the background to the project. Jennifer?
Thanks very much, Michelet, and thank you to everyone for joining. Yes, my name is Jennifer Charlton. I work for an NGO based in Johannesburg called Heartlines. And we've been a social behavior change communication organization for the past 20 years or so. We call ourselves the Center for Values Promotion. And we've been involved in a number of campaigns around values promotion, mainly using mass media. But coming into the mental health space was something new for us. We were asked by the Foundation for Professional Development to join them on a project on mental health. And so it was a project which they tended for and got funding for from PEPFAR. And the main aim of the project is actually to integrate mental health into HIV and TB services. And then session partner. Sorry, I think someone's mic is open. If you mind, maybe just checking that that your mics are are closed when you join. Thanks so much. So yeah, it's mainly an HIV and TB project trying to show that if people's mental health is improved, then the chances that they will stay on the HIV and TB medication will be greater. But we were given the opportunity to do a broader scan of mental health in South Africa and to come up with a strategy that would, first of all, just raise awareness around mental health and also tackle the stigma of mental health. So as relative newcomers into the mental health space, what we found from organizations who have been around for a lot longer than we have was that there seemed to be a lack of images that were readily available to depict mental health in a kind of positive way. So what we mainly do is create social media posts, and we also do some short videos, and we've done some radio work as well. But also through the Global Mental Health Awareness Network, GMAN, we attended some webinars and also learned more about what people who've been doing this for a longer time have also been saying about it. And we came across what you'll hear about more on this webinar today from our guests who are also going to share with us. And so we decided to collaborate. We've been very collaborative on our journey, and we collaborated with the South African Federation. We commissioned the photographer, Natasha, who's also on the call today, on the webinar here. So yeah, thanks very much to Natasha, and Mishle linked us up with one of the facilities, and Natasha has taken these beautiful photographs that have now been curated and which will form this of the start of our mental health library. And just to say that we do just see this as being a start. It's by no means comprehensive at all. It's that we wanted to put our foot into the water, and Mishle will also talk a bit more about how we see this possibly rolling out, also building on what happened in the UK. So I think, yeah, that's enough from me. And so maybe I'll head back to you, Mishle, to carry on.
Thanks so much, Jennifer. Thank you. And yeah, as Jennifer mentioned, we worked with Central Gauteng Mental Health Society, who is one of our member organizations. They form part of the federation, and we worked with the residents at Gordonia to put this photo library together. So we're really appreciative to them as well for, opening up their home essentially, and showing us what it's like as they take on their daily activities. Stigma remains a real barrier to help seeking, to treatment and recovery when it comes to mental health and mental health conditions. But research has really shown that images can have a strong anti-stigma effect, and that photographs play a significant role in the way people view mental health, but as well as how they view persons living with mental health conditions. And so the aim of this library really is to destigmatize mental health, and for us to share positive photographs of persons living with mental health conditions. As Jennifer said, we were inspired by the work of the Mental Health Foundation UK. So I want to welcome Alexa Chandley, the Director of Fundraising and Communications at Mental Health Foundation, to share a short statement. Over to you, Alexa.
Thank you. Yes, thanks for having me today. And it's great to see this work. At the Mental Health Foundation, we're kind of our remit is around prevention of mental health, and how this kind of plays into our image library is that we know that the images that we see every day shape the way we think about mental health. And too often images used by the media and in materials designed to support people can, as you say, reinforce stigma, negative stereotypes, and focus only really on poor mental health. So we've, with the help of people across the UK and with the generous support of Pinterest, who are our partner with this, we've begun to change that. And asked people to make submissions from the public And we also took imagery from our work with people with mental health problems and from the Mental Health Foundation staff team. And our library has grown into a vibrant resource. It's got images across multiple themes, movement, the workplace, and the latest edition that we've had this year has been community, which was the theme of the UK's Mental Health Awareness Week in 2025. We believe that by sharing photographs of real moments of connection and resilience and well-being, that our positive mental health image library is starting to help shift the narrative and promote a more positive and empowering understanding of mental well-being. So we're really proud of our image library, and we were delighted to hear that it had inspired a similar project in South Africa. So we want to wish the South African Federation for Mental Health Project all the success, and we hope that it's going to really help support the mental health of people across South Africa.
Thank you so much, Alexa. Yeah, no, we are so thankful to you for the support you've shown us. And I think, from our side as well as Masiviwe's side, it was looking at this positive image library and thinking, wow, this is so great. But then thinking, how do we put that into the South African context as well? But thank you so much for joining, and again, for being so supportive of the project. Now, I want to welcome our guest speaker today, Sue Baker. Sue has worked to destigmatize mental health for almost 30 years across the UK, New Zealand, and globally. Sue set up the Time to Change campaign in England in 2007 that led to a huge change in public attitudes and reduction in discrimination and stigma in England. But she has been working on shifting stigma since joining Mind, which is the UK's largest health NGO, in 1995. Sue then founded Time to Change Global in 2018, working with partners and people with lived experience in Africa and India to tackle mental health stigma across a range of cultures and contexts. Sue now advises international bodies, governments, NGOs, funders, and networks of people with lived experience on social change programs aimed at improving public attitudes, reducing discrimination, and empowering people with lived experience to lead change. Sue also runs an independent consultancy called Changing Minds globally, and she was one of the sub-authors of the Lancet Commission on Ending Stigma and Discrimination in Mental Health that was published in 2022. And she was also part of the team who worked on the World Health Organization's Mosaic Global Stigma Toolkit that was launched on World Mental Health Day last year. Sue is joining us today to share more about the impact that imagery has on stigma, as well as the powerful role that the media has to play in breaking stigma. Welcome, Sue. I'll hand it over to you.
Thank you so much, Michelle, and thank you for the invitation. It's a joy and an honour to be here to see this amazing resource launched. And Alexa, thank you for your inspiration as well. And we should catch up at some point too, as we're in the same country. But yeah, it's brilliant. And thank you so much for the inspiration and what was shared on the one of two global stigma networks, where it's all about peer support, peer shared learning and tools. Often we're facing the same challenges, but in very different contexts and cultures. And sadly, stigma and discrimination of mental health is common to nearly every culture and context. It presents itself differently. There's no one size fits all response, but there are some core methods that help address stigma that are evidence-based, but constantly evolving and innovating, just like you are doing today, which is brilliant. And thank you so much, Natasha, for the photos, and to the Gordania, residents. Just thank you so much for being willing to be photographed. This will make a big difference. And I'll share a bit more about our journey in the UK. Yes, I have been around a long time, and I realise that profile picture on screen shows all my wrinkles, so I'm going to have to change that. So yeah, I joined Minds, which is the UK's biggest mental health NGO, in the mid-90s. I could see what a grave social injustice it was, the stigma and discrimination of mental health compared to physical health issues. And I just thought, if I do one thing in my career, it's to do something about this. And I'm very lucky I've been able to do that in my career. So we've been on a long journey here in the UK and England. But I have the great delight in working with amazing partners around the world and people with lived experience to create something driven by local contexts and local attitudes and involving local people with lived experience. to drive forward that change, which is what the Lancet will evidenced as the, what are the effective approaches. There is a section in there on working with the media, so it might be worth looking at the Lancet as well in the section on the media. I also am somebody with lived experience. I've had 3 major breakdowns. So I know the impact that media have on ourselves and the people around us. Yes, we've had terribly stigmatizing media coverage. The media were always a target for our work at Mind. I was the first head of media relations at Mind. Nobody trusted the media to share their lived experience. It was all about violence, failures of care in the community, needing to go back to a time of asylum, about the pendulum being swung too far in favour of patients' rights and too far against public protection. That was the overarching media and political and social discussion around mental health. There was nothing else talked about. So I came at a very different time than we have now in mental health, but we still have a lot of stigma and discrimination to challenge in our context. I worked for Time to Change in 2007. We had outcomes of attitude change, reductions in discrimination, empowerment of people with lived experience. And what's really important is how the media has such a core part to play in that. So sorry, I'm just going to go back a couple of slides. Where we were at, sorry, Michelle, is some hideous headlines, as I was saying, all about homicides involving mentally ill people. You'd never hear from people with lived experience. Obviously, people were too afraid to speak out, understandably. Nothing about recovery, nothing about our rights, nothing about everyday life, nothing about stigma. So we wanted to do that as part of our media work at Mind, and then we had the media as a target in the Time to Change programme. So it was called the Media Engagement Project, and we had a brilliant woman who lives with bipolar and is an ex-BBC producer. So she ran our media project, and I'll tell you a little bit more about that in a minute. Yes, sorry, next slide, please. We did manage to secure change, even before Time to Change. There was a lot of the charities, including the Mental Health Foundation, working with the media to try and improve things. And this actually happened in one of our major tabloids. So this was before the days of social media, I think. Yes, it was. On the left was the first headline that caused outrage in our country, because this is a well-loved, famous boxer who had had a breakdown and been sectioned in psychiatric hospital. And because people literally hit the phone lines and jammed their, this is when phones were the main form of communication, jammed their phone lines, they actually realised what a public outcry there was against mental health stigma and changed it to a much more empathetic headline. And so that was people power way back in the days before social media. So just moving on, and obviously we do that in very different ways now, reacting back. So why the media? I think you all on this call, because you understand the important role of the media and you're involved. But we did a survey of Time to Change anti-stigma supporters about 5 years into the programme. And 80% thought the media coverage was poor. So that was our mandate, continued mandate. Many had been affected by a storyline in the media. However, there is a positive role for the media. A third said that news stories helped and encouraged them to seek help. Nearly 2/3 said news stories helped them feel like they weren't alone, which was one of the lies that come with mental health problems, is this feeling of being alone. Nearly half said that news stories helped them improve their understanding of the issue, and that is a key role that we've worked with the media on, as well as anti-stigmatising coverage. And that news stories were interesting. There were more likely news stories to help men seek help than women, just slightly more. So just carrying on this theme of why the media, people with lived experience, we had about 7,000 lived experience champions that we supported, and young people in England. And this just talks, we all know this, about how somebody said, the media does have a big influence. I was hugely reluctant to see a doctor because you don't want to be seen as a lunatic. And that's what we know is this awful impact that the media can have. So just moving on to the next slide, please. However, there are things that can be done. There is a lot of guidance for the media. There are lots of different versions of media reporting guidelines. Suicide reporting guidelines. There are many different versions around the world. We at Mind have some. The previous anti-stigma programme the government ran had media engagement and media reporting guidelines as well. We've worked in Kenya on some. I know there are many different countries that have got media reporting guidelines, which is great. You can't just tell someone off, you've got to help and support them and co-create some tools for change. So right at the bottom, what makes more responsible coverage is also including photos of contributors work well, and obviously, as opposed to simply talking about the illness, having somebody with lived experience as part of that. So that underlies all of the work that you're doing, that Alexa's been doing for a long time, and that we were doing at Time to Change of Mind. Sorry, next slide, please. So on a more positive note, we had so many, eventually, media volunteers at Mind, and then champions and media volunteers at Time to Change. And there's someone who was one of our media volunteers talking about that actually being a media volunteer had changed her opinion of the media, and seeing them as understanding and raising awareness. They can do a lot of good. And she says, unquestionably, this process has been pivotal in my own recovery. So it's really important that people have a good experience of working with the media and sharing their stories. And there's a huge amount of support that goes on behind supporting those of us with lived experience to safely share our stories with the media. So just next slide, please, which is as part of the GMAN Stigma and Discrimination Working Group session on responsible sort of imagery, and we've also done one on language. Laura Alton is a graphic designer, but she did this brilliant piece of research into stock images and whether they are sort of perpetrating stereotypical perceptions of mental health problems or not. So I've credited her here. She presented this research and it was absolutely brilliant. Sorry, next slide, please. So thanks to Laura for her sharing this in one of the previous sessions. These sessions are all recorded, so if you become a member of the GMAN working group on stigma, you can access recordings and slides. So there's a lot of this online if you want to see it. So the thing that she was saying about stock images, and obviously it's for all the media to access, they often pay to have a subscription. The Mental Health Foundation and our image library was obviously free to use. We want to make them as accessible as possible. That's right, isn't it, Alexa? It's free to use. Yeah, yes, that's right. But the constant use of some of the more regularly used images, if they're negative, can really reinforce negative perceptions and stereotypes, and kind of limited understanding of mental health in a negative way. And what Laura wanted to find out was this the case? Are stock images doing this or not? So sorry, next slide, please. I'm conscious of time. So what she ended up doing is a research just on the words mental illness on one of the most popular image libraries in the world, which is Getty Images, used by millions and millions and millions of journalists and editors. And she took the top 50 that came up, the most popular used ones that came up from research. I won't go into all the methodology. It's on her slides, full set if you want them. So when she did some kind of thematic analysis of those 50, I won't read it all, but 23 reinforced a kind of conception of lone individuals in a distressed emotional state. 14 were people in a patient and healthcare worker dynamic, so very much sort of clinical, you're a patient kind of dynamic. 6 of the images were sort of broken brain metaphors. And then there were a further 5, which was slightly different and harder to categorize. But can you see anything positive in that? I can't really, can you? So I thought her work as a graphic designer who's passionate about stigma as well, to undertake that was absolutely insightful. So I think we've hopefully made the case, and that's why you're here today, and you're already doing this work, I'm sure, about why images are so important. And so I'm just going to move on. So what have we been doing about it? So as well as the Foundation's fantastic image library, which was brilliant, Time to Change launched a campaign called Get the Picture. So a well-known sort of actor and comedian called Stephen Fry, who happens to be quite a well-known celebrity in the UK and parts of the world, was our president, and he agreed to be the kind of front of this, doing the posed head clutcher, which is one of the most annoying, commonly used, lazy, stereotypical images people use. So he posed for us and we ran this campaign called, I think it ended up being viral on social media, and it ended up being called Ditch the Head Clutcher. So that was the background to then launching the image library that we launched. And we had a big social media campaign. You can see the Samaritans there, so sharing it. So we surveyed 2,000 members, and 8 in 10, this is when we launched the campaign, said that the head clutcher images don't show how it feels to have a mental health problem. 1 in 3 said that images of suicide triggered suicidal feelings. I hope nobody's triggered by that now. If they are, please reach out to us. And one quote was, people with mental health problems don't look depressed all the time, like it's not our defining identity. Can we be a bit more creative, please? So then we worked with, sorry, next slide, please, with an amazing organisation called the UK Pictures Editors Guild, who had never, ever done any kind of work on mental health, but they had a really good chairman called Alan Sparrow, and he went into partnership with Time to Change. And we did a big launch with picture editors, and journalists in London. And he thoroughly endorsed the freely available images and encouraged their use across all types of media. So these were high res, free to download. We had our own page on a image library organisation called Newscast. And then that's how we did something to help with images, really, to help the media get it right. And many of our campaigners and many other people as well who were passionate about this would let us know if they saw the use of the head clutcher. It sort of ended up being something people reported on social media to us or emailed us and tagged us so that we could say, just a reminder, we've got this image library. So it's quite an active part of the campaign. And I'm just going to move on very, very quickly. Here are some of the images at the top and how they were shared on social media. More media guidelines from Time to Change. And we had a whole load of Meet the Media workshops with Johnny Benjamin, who's a brilliant campaigner, but with reporters and editors training other reporters and editors, so talking to their peers. And most of those reporters and editors were open about their own lived experience. So it's very much coming from within the sector rather than the mental health sector taking media off all the time. So they were saying, well, this is how we do it. So it's very much about sort of peer learning and inspiration. And after all of that, how did we measure whether the media had changed? So we had a very significant improvement through academic evaluation from King's College London. You can see we started with stigmatising articles were at 31%. Sorry, yeah, anti-stigmatising articles were at 31% and stigmatising were much higher at 46%. And then it flipped. So stigmatising went to 50%, 50% went up. And stigmatizing went down, anti-stigmatizing went up, and actually over time that just increased and increased. Lots of people with mental health problems were main sources in stories. However, there is still more work to do on the reporting of schizophrenia, which was the only condition that was more stigmatizing than not stigmatizing, and the danger to other and hopeless victims still appeared. So it doesn't mean job done, but major progress made. There was also evaluation of TV and drama coverage, which significantly improved as well. We worked with about 80 producers and script writers a year from all the major soaps. When we started, the scripts that I used to see as head of media at Mind was always somebody with schizophrenia with a knife about to stab and kill somebody. And that's all you'd see, just like you would in the rest of the media. Now that has changed very significantly. And many of the major characters in our soaps have got a mental health problem, and you see them through their journey and their struggle to get help and stigma. And they're loved. I mean, we just say it's part of their character's DNA, is what the producers say now. It's just a part of life. They're not the mentally ill character in that storyline. So we did a lot of work behind the scenes, and often actors that were portraying somebody with a mental health problem would come and meet our champions and learn more insight, so it could be more responsible and accurate. So I think the only other thing to say is this isn't all about the UK's work. There's some brilliant work to learn from as well. Sorry, that's the academic paper if you want it, on the improvements in print media coverage in England. We worked with 5 amazing mental health NGOs in Africa and one in southern rural India. One of them was Basic Needs, Basic Rights Kenya. And as part of their stigma pilot and then ongoing project, so it's been going for about 5.5 years, was a big focus on a social marketing campaign, training people with lived experience as champions, social contact, and a partnership with the Media Council of Kenya, which is quite a unique partnership. I haven't heard of anything quite so strategic. we presented, Rosemary, their chief exec of BMBR, and I presented a big global stigma meeting last year in June. So I've got an abstract and I've got her full slides if you want them. So their approach of working with the Media Council was spending time with editors and journalists and influencers, doing some training. We had champions hosting and helping co-deliver some of that training, producing a draft set of reporting guidelines. And the key here about sustainability is by working with the Media Council, we funded to bring in a curriculum specialist. So she has developed with the Media Council and BMBR, and I was involved as well, a curriculum so that mental health reporting accurately and responsibly is now going to be part of all ongoing training for future journalists. So it will sit as a core curriculum issue. I wish that was the case around the world. So I think just to say they did an independent evaluation of the media, and the last two slides are just to say the share of media coverage focused on mental health through the lifetime of that project has significantly increased from 4% up to 7% and then up to 12% in 2026. So mental health is getting more of a share of media coverage. The important thing is it more anti-stigmatizing than it was before? So the final slide is just to say, oh, sorry, you might have to keep pressing click to see if this comes up. No, I can't believe that is not coming up. No, it's just to say that the media coverage significantly improved. So this is, it was radio, it was print, and they're also monitoring messaging across social media. So, for example, it was only 15% positive in 2021. That went up to 50%. And the negative was 52% in 2021. That went down to 20%. Neutral remained about the same, of about a third of coverage. So that's it from me. Sorry it went on so long, but hopefully that's some inspiration from around the world. And I know that many mental health organisations see the role of the media. And I think it's really important we keep sharing with each other. I hope and I know you will inspire other people too. Thank you so much for the chance to talk today.
Thank you so much, Sue. That was amazing. Thank you for sharing your insights and just your expertise. I think knowing that this work has been done and that it does, provide impact, and the fact that people's attitudes do change is so inspiring. And I think it will help us to keep going as well. So thank you again, Sue. So just a bit more about, the library that Masiviwe and the SA Federation have put together. Similar to what Alexa was saying, we've also divided the photographs into categories. So self-care, community, keeping fit, creativity, support groups, and following treatment plans. And so, the idea behind this is how can people take care of their mental health? I also think it's important to note that, the photos that were taken were based in a community residential facility. And I do think that the photographs also show the positive sides of community-based mental health care and what we talk about when we advocate for community-based mental health care and for more investment into it in the country. You can find the library on both the SA Federation for Mental Health's website, as well as the Masiviwe website as well. And we really do encourage the South African media, as well as all persons active in the mental health space, to download and use these photographs. They are free to download. And we want you to use them in stories that are positive stories, that are focused on persons with lived experience of mental health conditions, but also to promote good mental health for all. I think one thing we definitely want people to note is that these photographs should not be used to depict specific mental health conditions. And we don't want these pictures to be used to depict negative stories about persons living with mental health conditions. We really want these photos to be used by the media when sharing positive stories, or when, again, promoting ways that people can take care of their mental health. That's really how we envision this photo library working. As Jennifer also said, this is just the beginning. So you'll see that, there's not millions of photographs, but the idea is that, and it's similar to what I know Mental Health Foundation UK does, is that we want to then turn it back to society, to communities, and to persons with lived experience, and ask them to share their own photographs of themselves taking care of their mental health. And that's something we would then want to be uploading onto the library as well. So definitely a moving, living, breathing library, and something that we just hope will feed into the overall strategy of trying to end stigma of mental health in the country. I'm going to hand over to Jennifer now, who will open the floor for Q&A. Jennifer?
Right. I also just wanted to add that in terms of looking for images to depict various things that we were going to be sharing about, we also found that there was a lack of South African images particularly. And so, if we were telling someone that meditating, would be something that they could do, the kind of stock images that would pop up would be of someone sitting on a beach somewhere with the sunset. And that's not really the lived experience of most of our people. And also, if it was go for a walk, it might be images of someone walking through this beautifully manicured park somewhere with lots of greenery. And yeah, we just wanted to show a little bit more realistically of, if you live in South Africa today, what does it mean if we are encouraging you to take a walk? It might mean just going around your suburban block. Meditating might be just lying on your little piece of grass, staring up at the sky. So that was something else that we particularly wanted to show. And yeah, as we've said, we also want to just emphasize that it's just a start, and we will hopefully be adding to it. Are there any questions or comments that people might have? See a hand from Dr. Ngobo.
Good afternoon.
Yeah.
Yes, good morning, everybody. I'm Samke Ngobo. I'm a medical doctor who's living with bipolar disorder since the age of 14 years old. And as she was presenting, I was actually reflecting at the younger version of myself, how I would have benefited to have positive images to reflect on and relate and connect with, so that my journey was less traumatic, because I experienced stigma on all the levels because it wasn't as understood as it is now, and there's still so much to do. So culturally, religiously, socially, I experienced all aspects of stigma as a young person. And it's very damaging to how one identifies then with the illness. So I'm very grateful to Michelet for having, that I literally stumbled on this advert for this presentation, and I allocated time because I just thought the subject matter is critical. And you're correct in saying that we do need more people from South Africa that share their lived experience in a realistic, representative manner, so that it's relatable and people can connect. So I'll stop it from here and just want to say thank you so much. And SAFMH is an amazing organization that does incredible work, and this is absolutely the next level in what they're doing.
Thank you so much, for taking time out from, I'm sure, what is a very, very busy schedule. So we very, very touched that you did that. And yeah, I'd encourage you to look at our website, which is www.masiviwe.org.za, because we have a number of short videos. So we have a series which is called Let's Talk Mental Health, and we've done a number of videos on different topics with people talking about their lived experience. So we have one that particularly is around men and mental health, called Gents Let's Talk. And we've got some men talking about, I think, what you were alluding to, that culturally it's been not done for men to talk about their mental health particularly. And then we did a video actually at Gordonio as well, where we spoke to some of the residents, and some of the residents shared about stigma. So that's our Let's Talk Mental Health Stigma one. And then we've also done one on substance use, and of people who came through substance use and have, you know, things to say around that. I see, Leandri, you've got a question. Do you want to unmute and just ask your question?
Morning, everyone. Thank you. And I just want to congratulate everyone on the very inspiring work that you've presented. It's slightly off topic, but related. I just wanted to ask whether anybody on the panel could give any sort of direction on also guidelines on language to use around mental health. We are busy doing some of our own surveys to understand how people perceive certain terms. Even the term mental health sometimes is perceived as quite stigmatizing. And I would appreciate any sort of pointers as to where we could also look at maybe work other people have done in that area. Thank you.
I don't know whether Sue or Alexa want to jump in on that one.
Yeah, very happy to, unless Alexa, do you want to go first? Go. Okay. That was actually a topic of the next session in the Global Mental Health Action Network, Stigma and Discrimination, was about appropriate language. And there were some really good presentations and resources shared there. So, Leandra, if you or if Michele sends me your email, I can give you a link to, so you've got to sign up to the working group to access all the previous recordings, but you'll see the PowerPoints and the recording of the session, which obviously hopefully might be helpful. But I mean, yes, absolutely, language. I think because people have historically focused on language, photography and imagery got left behind. So what we've done is we did 2 separate sessions so that we could focus on them both. But I mean, we had to think about that when we started Time to Change. We spent a year in research. Well, before that, did a massive survey of 6,000 people with lived experience about where's stigma coming from, what's driving it, what can we do about it, what messaging would you like, what kind of, is it shock tactics, or people lived it, you know, what sort of core propositions would you like us to take, and the kind of, you know, tone of voice you'd like the campaign and the whole program to take. So we did a lot of that, and one of those things around language, and everywhere I work on stigma around the world, there was often a line of people that say, we can't use the word mental or mental health because it's stigmatizing. And we had some of the same sort of pushback. I mean, you're trying to keep a whole nation united, and those of us with lived experience as diverse as anyone else. But if you avoid using that language, you'll just create a new word or a new language that will become stigmatizing. The issue is the stigmatizing of mental health. But the things that were shared were really helpful. Like there's a massive campaign in Pakistan called Milkar, which is from Taskeen. They presented their work, Taskeen and the British Asian Trust. And I can't remember how many millions of people they're going to reach. And they've already reached a lot of people. And they have multiple different ethnicities, languages, you know, communities. So they've had to really dive deep into communities to make sure they're inclusive of all. So they were really good and some cultures and contexts. I know in some parts of India, you know, depression isn't a concept. You know, it's in some Asian cultures, it's sadness or distress or, you know, different kinds of feelings. So it's got to be appropriate. So you've got to spend time with your communities, both people with lived experience, to make sure that the language is going to be supported and is not going to create further problems. But you've got to, what most people forget to do in our field, which is why I see many campaigns in the past not working, is you have to find out what works with your audience, because they're the people you're seeking to reach. Hopefully, what you have to at the same time empower those of us with lived experience. So you've got to get the balance right. But if you use terminology the public won't understand, or journalists, you've lost the battle. So we spent so long in focus groups and in in-depth research because we were a big national campaign. So, and there was a big divide. So there were 2 partners in Time to Change, Mind and Rethink Mental Illness. clues in the title that they use mental illness, so about severe and enduring mental health problems. Mind was the whole spectrum, including prevention and promotion through to severe and enduring. And, you know, we had loads of public information, millions of people accessed information about all kinds of mental health problems. And we use mental distress. And they're two very different types of language, aren't they? And we were trying to keep both our people with lived experience and our very passionate, active supporters and the public and the media and politicians. So we had to keep testing what would work with both audiences. And so we decided to interplay it. So not just having one defining, because we had partners with different languages and the boards wouldn't have been happy. So we used both. We interspersed it. We decided to not go with one. And we talked about mental health problems, which some people didn't like because of the word problems. And some people didn't like distress because it sounded like your cat had been run over, which is very distressing and very upsetting, but some people thought it minimized the severity. Some people don't like mental illness. I don't personally like conditions, but that was used in the Lancet Commission report. I was like, oh, can we please not talk about mental health conditions? Because it sounds a bit medical, but so we've all got our different views, but the best thing is to test, compromise, find something, but it's got to work with both audiences, but it has to work with the public if your outcomes are about public change without causing further harm to those of us with lived experience. So it's a very good question. There was a really good discussion about that on that working group. It's a brilliant question.
Thanks very much. I'll definitely go and have a look at that. Thank you very much.
Welcome.
Yeah, thanks, Sue. I mean, it is obviously something that we have also spent a lot of time on. In South Africa, we have 11 different official languages. And so, yeah, it is really a big issue. And even, as you've mentioned, the same as what has happened in India. So even within one of the big language groups, the word depression has got at least 5 different translations of it. And so it's, you know, it's really impossible to just say, and a lot of our languages are also quite dynamic. And so there's not really a point of saying this is the mental health dictionary and this is how you say this term in that language, because it's evolving all the time. And we've just, you know, we've encouraged, we've got helplines in South Africa, such as yeah, I mean, the South African Federation has a helpline, but SADAG, which is another big NGO, also has a number of helplines, and they do encourage people to speak in their mother tongue and to express themselves in whatever way they feel comfortable. And they have counselors on the other end that they can speak in any of the languages. But it is something that we have had a lot of conversation around. We do have some material on our website, which speaks to things such as if you're talking about suicide, I mean, the very high level ones, say this, don't say that. And I know that SAFed also has material for the media on how to report certain sensitive topics. But I think it is something that is quite evolving over time. Are there any other questions which might have popped up? I see Colleen has mentioned something. Leon, you have a question.
Actually, it was pertaining to, was it Leandri who asked the previous question?
Yes.
Leandri, may I just ask, are you a journalist or what is your specific?
No, I'm the National Manager for Mental Health for Mediclinic.
Okay. I think maybe just, I know we've heard from Sue, just to say that in the South African context, there are a few very basic principles that we as an sorry, I'm from the SA Federation for Mental Health. I'm the Deputy Director. A few very simple things that we try and use, and that we've shifted in terms of how we also speak about persons with lived experiences, not using language, because people often write about people suffering from bipolar. So trying to avoid anything to do with suffering, and rather saying a person with lived experience of bipolar. Our Mental Health Care Act talks about mental health care users. So when you talk to government, you have to kind of use that. And I think it goes to what I think it was Sue saying, you have to kind of look, or maybe it was Jenny, but you have to look at who you're speaking to. When we speak to government and, our policies and stuff, it's mental health care user. But if we look at our own work around the media, we talk about persons with lived experience. And then coming from the South African disability sector, which is a very vibrant and very they feel very strongly about certain things, and I think there's also things about concepts or principles, but not talking about a schizophrenic, but a person with schizophrenia. So they have a thing about putting the person in front of the condition. So little practical things like that, not committed suicide because it sounds like a crime, talking about somebody dying by suicide. So yeah, and Sue, I know you were saying that you don't like the mental health conditions thing. I think that's a very personal thing because we had a mental health conference that was convened by the Foundation for Professional Development that Jenny mentioned earlier, and I think Charlene Sunkel. So Charlene, who used to work for our organization, and I've known Charlene for many years. She was a member of my team. Charlene, I remember her at that meeting saying, and Charlene's a global mental health advocate around lived experience, a person with schizophrenia. And I remember specifically Charlene at that conference doing a talk in the plenary and saying that for her, she prefers mental health conditions. So I think it's a very personalized thing. But yeah, I just wanted to give a few local kind of contextual examples to Leandri, because I wasn't sure what her role was. I was wondering whether she was perhaps a journalist. So I hope that helps.
Thanks, appreciate it.
Thanks, Leon. I think in the interest of time, maybe I hand back to Mishle just to wrap up.
Sure. Thanks so much, Jennifer. And thank you to everyone for their contributions and all the questions and just the conversations happening in the chat as well. I think this is exactly what we wanted when we, thought about, we don't just want to put the library out there and just, send a link to everyone. We were like, let's do a launch. Let's make people aware, but also let's start the conversation of what we can really do with regards to making sure that we are ending stigma within communities, but also within the media as well. So just again, thank you to everyone for engaging. From our side, we just had a quick evaluation that we would really appreciate if you guys could fill out. So you can either scan the QR code on the screen. I'm also going to pop the link into the chat. And if you could please fill that out, share your thoughts and opinions with us, we'd really appreciate it. From our side, it will just help us to know, whether or not the library is something that you're likely to use, but also how you found the launch as well. You can do that now or in your own time as well. It is open for the rest of the day, so I appreciate it. But if there were no other questions, I think we would just love again to extend our deepest gratitude to Alexa, to Sue for joining us today, just to everyone who's taken the time, to Natasha for the wonderful photographs, to Central Gauteng Mental Health and the residents at Gordonia as well. And of course, from me to Jennifer, thank you for being a great partner in this journey. And I know I'm just really excited that, this is one of the first steps we're taking with the library, and we hope that persons with lived experience will also start sharing. But we really hope that this will be the first step in really starting to shift the conversation in the media, especially in the country. Thank you to everyone again for joining. And again, if you have any questions about today, please do feel free to reach out to me. That's my number as well as my email address. And I think just speaking, I know Leandre asked the question earlier, but yes, we can share the presentation with everyone who attended today, as well as the recording as well. Was there anything else from your side, Jennifer, before we close off?
No, nothing more from my side, just to say thank you again to everyone. And I did also want to acknowledge my colleague, Emma Delius, who I don't think managed to join the call today, but she was working with me, has moved on to a different organization now, but she actually was the person who put together and went with Natasha and took the photographs and was support, and has also been a great support in all the development of the content on Masibiwe to date. And so, yeah, just wanted to shout out to Emma.
Shout out, Emma. Thanks so much, Jennifer. Thank you again to everyone for joining. And please do engage with the library and let us know your thoughts, whether it's via email or just commenting on both our social media pages as well. Have a lovely rest of the day, everyone, and thank you again. Bye. Thank you.